Now that we've relaxed the muscles that relate to the nerves, we have the possibility of actually flossing the nerve or gliding the nerve relative to those places, so as to unstick the nerve. So sometimes when a muscle's been really tight and compressing a nerve, things get all inflamed and the nerve gets stuck, the sheath of the nerve gets stuck to these things. So I'd like to show you some neural flossing for various locations. The first location I'd like to show you is how to floss the nerve, or the nerves, as they pass underneath the clavicle here. So they come out of the neck and they're anchored to the neck. So if I move my neck this way, then it pulls the nerves from underneath the clavicle. If my clavicle is elevated and I pull my head this way, then the nerves are free to glide proximally or toward my head. If, however, I bring my shoulder down like this, then the nerves are drawn because they go up the arm. They're drawn to pass, where they pass underneath the clavicle, they're drawn distally or out my arm. So if I had my head turned this way and I go this way, then I'm pulling from the two different directions at once. What I'd like to do is not as challenging that as stretching the nerve. I'd like to glide it. So when we pull the nerve toward the head, we need to make sure that we've got some slack out at the shoulder. So the shoulder has to come up a bit, so the nerves are free to glide between the clavicle and the rib that's underneath it. So I pull my head to the side, and then, so the nerves are being pulled this way, then I bring my shoulder down and allow my head to come back. So then the nerves are free to glide distally. So I pull my shoulder down, there we go. And you want to get to this point where you can feel the nerves being under tension there. So I've got some nice tension, so I'll pull them out, or out and up, and allow them to come that way by lifting my shoulder this way. And then I'll pull them distally and give myself a little bit of slack so they'll go that way. So I'm pulling them up and out, and now I'm pulling them down and out. So now I've got a lot of play between the nerves of the brachial plexus and the clavicle in the first rib. The slide I'd like to show you is that of the brachial plexus underneath the pectoralis minor muscle. So to do that, I need to pull them distally, or pull them towards the head. So I pull my head this way. And then the competing movement is to draw them outward. So if I put my head in neutral, the way I draw them out is to bring my arm up to about 110, 120 degrees from the horizontal. And I'll extend my wrist so that pulls the nerve, the median nerve, distally. And I'm going to externally rotate my arm at the elbow so it locks underneath the pronator muscle. And I straighten my elbow so it's stretched this way. So I've got a nice grip on the median nerve out in my arm. So when I pull in this way, it's going to pull the whole brachial plexus with a bias toward the median nerve out from underneath my, my coracoid process and my pectoralis minor muscle. So I can pull it distally this way, and then if I give myself some slack, so I've got this much slack in the plexus, now I've taken the slack out of it. Then when I pull this way, as soon as I pull this way, I'm feeling tingling in my hand. So I know I've got a really good grip on the plexus. The arm reaches out, I give myself some slack by my head tipping, and then I pull my head back, and I have to give myself some slack by bringing the arm in. So you know you got a good grip on the plexus when you feel tingling in your hand. And then you back off the arm pull a little bit so that the nerves are free to glide, so the tingling goes away. And then you pull on it with the hands, you get the tingling, and then release the tingling by bringing the head up. When I take the slack out of the system, you can see how my arm and my head and neck are much freer to go. That's because the nerves have been unglued in that area. Next next neural glide I'd like to show you is that where we pull the median nerve proximal toward the center of the body, and then we draw it distally. The nerve can get adhered to the fibrous roof over it, the flexor retinaculum, and sometimes to the tendons, and there's sheaths in there too. So it's good to floss it this way, floss it that way, so that we unglue it. Manually, this is often done, with the therapist's hands, but you can work on this yourself as well. So the best position for this usually is to let's create some tension distally in the nerve. So we open the fingers and open the thumb, bring the wrist backward like this. So that gives us, it's drawing the nerve distally. And then I organize myself so that I'm pulling on the nerve proximally as well. Just like when you're flossing your teeth, if you pull on one side and you're loose on the other hand, and then you relax that and pull, you're not going to get a really good floss. You want to keep the floss taut. So you pull on one, you're feeding it and allowing it to go with the other. So you get a much cleaner floss. So that's what we're doing here. So we're tautening the floss by tensioning the nerve distal to the retinaculum in our hand by going like this. Then we straighten the elbow, so the nerve is on stretch across the front of the elbow, and we lock it out by externally rotating or supinating the forearm. Then we bring the arm back, so it's at least in the plane of the body, like towards the back of me. And then the shoulder goes down. So when the shoulder goes down, it pulls the nerve from the nerve roots in the neck, but it also it locks the nerve down between the clavicle and the first rib. Then to get the most pulling, so I take this back on the entire system, so I pull my head as far as I go to the side. And the last bit, I'll circumduct or rotate my arm so I get the sweetest, strongest feeling of tingling in my hand. At this point, so the whole nerve, the brachial plexus, with a preference toward the median nerve, is under tension. If I relax my wrist, then what's happening is the nerve is being pulled towards the center of my body. And then when I go to extend the wrist, I'm going to get some sweet tingling, so I have to bring my head up a bit to give myself some slack. So I'll pull the nerve this way, and as I do, I have to flex the wrist, and then when I go as far as I can with my head, then I extend with my wrist until I feel tingling, and I bring my head back to neutral. So again, this is the floss. Let me get a good feeling of pulling. The last thing I'd like to show you is a stretch for the median nerve, and this is to release adhesions inside the nerve. So the way we do that is we place the nerve on stretch by extending the fingers and the thumb, extending the wrist, supinating or turning the thumb back, extending the elbow, bringing the arm down, bring the shoulder down, circumduct so you feel the most tension, then you bring your head away. There we go. So at this point, my entire brachial plexus is on tension. I'm pulling on that meshwork by pulling on the median nerve in my hand. At this point, if I just stretch a little bit further, my wrist and thumb and fingers back, I'm getting a very strong stretch underneath the flexor retinaculum. I need to relax. There we go, into it. So if I let myself fully relax and breathe, and if the nerve's not too irritable, it'll actually lengthen and release. This releases adhesions inside the nerve, which cause the nerve to choke itself anytime there's more pressure on the nerve or anytime there's tension on it. Neural stretching is the strongest thing you can do, and it's the thing that's most capable of injuring yourself. So if you put yourself in this stretch position to organize yourself and it tingles and numbs, and you take yourself off of it, and it's still tingling and numbing and thrumming through your body, this is not for you. You need to stretch your muscles, and you need to maybe try the neural glides. Until you can do a strong stretch of the nerve, take it off and the symptoms go away. Until you get to that, you're not ready to stretch the nerve. To learn how to treat people with nerve mobilization, or for quality self-care information, go to nervemobilization.com.